Okay. Good afternoon, folks. This afternoon's topic A discusses the natural process of dying and highlights 10 physical changes that occur as the body prepares for death. So we're discussing end of life happenings for this afternoon for A. So please join me in discussion A for end of life care, folks. Okay, here we go. The article discusses the natural process of dying and highlights 10 physical changes that occur as the body prepares for death. It emphasizes that death is not a disaster, but a biological transition. And understanding it can help reduce fear and anxiety. The piece explores various psychological shifts, including changes in breathing, circulation, and consciousness, aiming to provide a more informed perspective on what happens in the final moments of life. Okay, as the body transitions towards the end of life, several psychological changes occur due to the gradual shutdown of different systems. First one, guys, is breathing pattern. Respiration often becomes irregular, slowing down or shifting to a pattern called Cheyenne strokes. Breathing, alternating between deep and shallow, folks. Deep and labored. Okay. Breaths and periods of apnea, temporary stopping of breathing. 2. Circulation and temperature. Blood circulation weakens, leading to cooler skin, particularly in the extremities. The body prioritizes blood flow to vital organs rather than limbs. Heart function. Blood pressure drops and the heartbeat may become erratic. The pulse weakens, signaling the reduced cardiac output. Skin changes, molting, a purplish discoloration often appears at the feet, on the feet, legs, and hands due to poor circulation. Fluid nutrition decline. The body's demand for food and water diminishes, resulting in less swallowing and decreased digestive activity. Okay. 6 is consciousness and responsiveness. Individuals may become less alert, drifting in and out of awareness. Some experience lucid moments, while others gradually lose consciousness. 7, muscle weakness. Loss of strength can make movement difficult. Reflexes slow down, and involuntary muscles twitch. Twitches may occur. Urinary and bowel function. Kidney function declines, leading to reduced urine output, which may darken in color. Bowel movement may slow, possibly resulting in constipation or incontinence. Sensory changes. Vision and hearing may fade. Some individuals might experience hallucinations or vivid dreams. Final moments. As the brain and organ function diminish, breathing gradually stops, and the heart ceases beating. Often, this transition is peaceful. Each of these changes reflects the body's natural progression toward shutting down, usually following a predictable sequence. Would you like insights into how caregivers can navigate these transitions and with comfort and dignity? Certainly. As the body nears the end of life, circulation gradually declines, because the heart's ability to pump blood weakens. This results in several noticeable effects. Reduced blood flow to the extremities. The body prioritizes sending oxygenated blood to vital organs like the brain and heart rather than hands and feet. As a result, fingers and toes may feel colder and appear bluish or molted. Hold on, folks. Losing my notes. Okay. Blood pressure drops. With diminished circulation, blood pressure steadily declines, making pulses weaker and harder to detect in peripheral areas. Skin changes. As circulation fades, skin may take a blotchy or purplish appearance. Molting typically beginning in the legs and progressing upward. Slower, metabolic processes. The body conserves energy by reducing blood flow to non-essential systems affecting digestion and kidney function. These circulation changes are part of the body's natural process of shutting down. Would you like insights into how caregivers handle? Okay, give me a second, guys. Into how caregivers can provide comfort during this stage. Caregivers play a crucial role in making the end of life transition as peaceful and comfortable as possible. Here are some key ways to provide support during circulation changes and other psychological shifts. Maintaining warmth. Since circulation weakens, extremities often feel cold. Using soft blankets, warm socks, and gentle touch can provide warmth and comfort. Now, folks, remember what I said in other videos about when people pass. Some of them like your hands on their feet. That's for warmth and to keep their skin looking good instead of drying out looking wrinkled. You put lotion on them when they're going through the process. It helps them relax and go quicker, or helps them, reassures them into that you'll be there for them. So okay, so we're going to go into maintaining one. I just read that. Repositioning for comfort. Changing positions gently can help reduce discomfort and improve circulation. Elevating the legs slightly may ease swelling. Hydration and oral care. Even if food and drink intake declines, keeping lips and the mouth moist with swabs or lip balm can provide relief. Creating a calm environment. Soft lighting, gentle music, and familiar voices can help soothe and reassure the individual. Managing pain and symptoms. Working with healthcare providers to adjust medications or non-medical comfort measures such as massage or guided breathing can ease discomfort. Okay, encouraging meaningful connections. Loved ones speaking softly, sharing memories, or offering reassurance can provide emotional support. Would you like more strategies specific to caregivers managing cognitive and emotional distress during this stage? Caregivers can, hold on. Provide emotional support by fostering a sense of peace, dignity, and connection during the end of life process. Here are some strategies: encouraging open conversation, allowing the individual to express their thoughts, fears, and wishes can provide comfort and reassurance. providing presence and reassurance. Simply being present, holding their hand, or speaking softly can ease anxiety. Creating a familiar environment, surrounding them with cherished items, photos, music can invoke positive memories and a sense of security. Okay. Facilitating meaningful conversation, encouraging loved ones to share stories. Express gratitude. Another closure can be deeply comforting. Respecting personal wishes, honoring their preferences regarding visitors, spiritual practices, or quiet moments can enhance their emotional well being. Supporting spiritual and existential needs, whether through religious rituals or meditation or reflective uh, discussion. Addressing deeper concerns can bring peace. Maintaining caregiver stress or managing caregiver stress. Caregivers should also seek emotional support, whether through counseling support, groups, or self-care practices. Would you like insights on how caregivers can balance their own emotional well-being while providing care? You can also explore more resources on end-of-life care at caregiver support. Providing emotional support at the end of life requires a thoughtful, personalized approach that respects the individual's needs and values. Here are some in-depth strategies caregivers can use. Deep listening practice or deep listening presence, active listening. Encourage open conversations where the individual can express fears, regrets, or hopes without judgment. Silent presence. Sometimes simply sitting quietly with them can provide reassurance and comfort. See legacy and meaning making. Okay. Next page. Dignity therapy helps individuals reflect on their life stories and share meaningful memories, can foster a sense of purpose. Personalized rituals, creating small uh, ceremonies such as writing letters or recording messages for loved ones, can provide closure. Okay, emotional validation and reassurance, affirming their feelings, acknowledge their emotions, whether it's fear, sadness, or acceptance, without trying to fix them. Encouraging autonomy, allowing them to make choices about their care and surroundings to maintain a sense of control. Okay. 4. Spiritual and existential support. Respecting beliefs, whether religious or secular, supporting their spiritual needs can bring peace. Guided reflection, help them explore their life's meaning through conversation or meditation. Caregivers self-care and emotional balance. Seeking support, caregivers should access counseling or peer support to manage their own emotional strain. Mindfulness and stress reduction. Practicing breathing exercise, journaling can help caregivers stay grounded during the process, folks. Okay, last page for A. Would you like insights on how caregivers can navigate grief after loved one's passing? You can also explore more resources on end-of-life care and maintaining dignity. Okay. That is A for you. I'll be back on with B shortly. For now, Gator Wellness. Take care, folks. I'll be back on shortly.